Welcome to the DSRIP Corporate Compliance Training. This annual training has three important objectives: to promote an overview of the DSRIP Compliance Plan, to provide information regarding fraud, waste, and abuse, and finally, to define your role in maintaining a culture of compliance. Because compliance is everyone's responsibility, please ensure everyone in your organization takes part in this training. It is essential that all services are provided in the most honest, transparent, and ethical way possible. The information in this training is intended to ensure our PPS partners are in full compliance with state and federal requirements related to fraud, false claims, theft, embezzlement, kickbacks, or other violations. Let's do a quick recap of the Delivery System Reform Incentive Payment Program, or DSRIP. DSRIP is the main mechanism by which New York State will implement the Medicaid Redesign Team Waiver Amendment. DSRIP's purpose is to fundamentally restructure the healthcare delivery system by reinvesting in the Medicaid program with the primary goal of reducing avoidable hospital use by 25% over 5 years. In an effort to meet that goal, NCI partners have been collaborating around several different projects, ranging from the integration of behavioral health and primary care, clinical management addressing our region's health needs, care coordination, office transformation through patient-centered medical home, and better alignment of the services our patients need. So what is a compliance program? A compliance program establishes an environment and culture that promotes self-monitoring, detection, and resolution of problems. The main focus areas of a compliance program include ethics and integrity in the workplace, compliance with state laws, and ensuring the flow of funds are not connected with fraudulent behavior or practices. An effective compliance program must contain certain elements as outlined in state laws and regulations. New York Social Services Law and the New York Code, Rules, and Regulations requires 8 elements. We will discuss each element in more detail. The first element is to designate an employee vested with the responsibility of the day-to-day operation of the program. The second element is to provide written policies and procedures that describe compliance expectations as embodied in a code of conduct and implement the operation of the compliance program. The third element, to provide training and education of all employees and persons associated with the provider on compliance issues, expectations, and the compliance program operation. The fourth element is communication lines to the responsible compliance position that are accessible to all employees and persons associated with the provider, and to allow compliance issues to be reported, which includes a method for anonymous and confidential good faith reporting of potential compliance issues. The fifth element is to provide disciplinary policies to encourage good faith participation in the compliance program. This includes policies that articulate expectations for reporting compliance issues. These disciplinary policies shall be fairly and firmly enforced. The sixth element is auditing and monitoring, and to create a system for routine identification of compliance risk areas specific to the provider type, including but not limited to internal audits and, as appropriate, external audits, and for evaluation of potential or actual non-compliance as a result of such evaluations and audits. The seventh element is to create a system for responding to compliance issues as they are raised, and for investigating potential compliance problems, and identifying reporting compliance issues to the department or to the Office of the Medicaid Inspector General and refunding overpayments. The eighth element is the policy of non-intimidation and non-retaliation for good faith participation in the compliance program, including but not limited to reporting potential issues, investigating issues, self-evaluations, audits, remedial actions, and reporting to the appropriate officials. Did you know that Medicaid fraud costs the federal government roughly $140 billion a year? A few examples of provider fraud include billing for Medicaid services that were not provided, billing for unnecessary services, selling prescriptions, and intentionally billing for a more expensive treatment than was provided. In addition to prison and repayment of Medicaid dollars, an unethical provider can also be placed on the Medicaid exclusion list and barred from participating in the program. We will discuss the exclusion list in more detail on the next slide. The Office of Medicaid Inspector General Exclusion List ensures that entities are not employing or contracting with excluded individuals or entities. The OMIG requires monthly screening of all employees, providers, board members, and vendors. The New York State False Claims Act allows whistleblowers to bring suit in the name of New York State when a wrongdoer engages in conduct that defrauds the state or local governments of taxpayer dollars. It is designed to address an array of wrongdoing, including healthcare fraud, to fraud involving any type of government contract or business relationship involving state or local money. We all have an ethical obligation to report fraud or unethical behavior. There are several ways to report this type of conduct. You can contact your supervisor, DSRIP compliance officer, or you can report the incident via the North Country Initiative website. So what is your role as a DSRIP partner in maintaining our culture of compliance? Know your compliance duties and how they relate to your daily tasks. Frequently review compliance policies with your supervisor and ask questions. Be familiar with the code of conduct and strive to achieve and sustain the standards. Do your best to identify potential problems early. Look at auditing and monitoring findings as opportunities for improvement, and when in doubt, contact the DSRIP compliance officer. Copies of the Code of Conduct and DSRIP Compliance Plan are available on the North Country Initiative website. Thank you for taking the time to review the DSRIP Corporate Compliance Training.